A 65-year female presents with pain in the lower abdomen area and in the right flank. Here we see Debrin's fluid in the pelvis and gut loops. The gut loops in the pelvis appear as echogenic loops due to fluid in the pelvis. These are gut loops, and gases are also seen in the gut loops and fluid containing debris. These are small intestines. The gut loops appears to be normal. No obstruction or dilatation of gut loop seen. Here we see the fluid in the right iliac area. Here we see the gases in the gut loops. This echogenic Debrin's fluid appears like a hemorrhagic. These gut loops are echogenic due to hemorrhagic fluid. Hemorrhagic fluid collection in the pelvis most likely appears in females due to ruptured cyst, or rare other pathologies may be seen. Here we see a mass, well-defined, heterogeneous, hypoechoic solid cystic mass. The ovarian masses are, or any pathology of ovaries, are always very painful for the patient. There is suspicion of ovarian mass in the right adnexa. Posterior to the mass, we also see a heterogeneous collection with echogenic debris. Now on color Doppler, we will see the flow in the mass. Minimal internal flow present. Peripheral also flow seen. Now we will measure the volume and size of the mass. For that we need dual mode and longitudinal and cross section size of the mass. Now we will take the three dimensions of the mass to take the volume. The volume of this mass is 51 ml. The uterus of the patient is absent as the patient has history of hysterectomy or removal of uterus. The left ovary is not visualized due to gases and empty bladder. Now how, now how we will write report. Uterus is absent as patient has history of hysterectomy. Right ovary is enlarged in size, measuring size 61 milliliter and shows heterogeneous solid cystic texture. On color Doppler, minimal or no flow present. Left ovary not visualized due to gases and partially filled bladder. Free fluid containing debris also present in the pelvis, most likely hemorrhagic. The ultrasound diagnosis is right ovarian mass. The patient is advised to consult with surgeon for treatment of this mass.